Journey into Ayurvedic Healthcare, brought to you by Troops in Tune. Hello, my name is Jenny, a disabled veteran and volunteer for Troops in Tune. Please join me as we journey into Ayurvedic Healthcare. The objectives of this course is to introduce you to the philosophy and scope of practice to Ayurvedic medicine. It gives you a deeper understanding of Sankhya philosophy, yoga philosophy, elements, and doshas. Also, Ayurvedic health goals and the understanding of the disease process. Lesson 1: History and Scope of Practice. Ayurveda is a medical science from ancient India, written in Sanskrit. Its origins extend from 5,000 years ago. It is an understanding of nature, the purpose of life, and includes physical and subtle aspects of health and disease. It encompasses our body, mind, and spirit. The mission is to know and realize the Creator internally and externally, expressing this divinity daily. With the use of self-care practices and herbs, Ayurveda helps maintain quality and longevity of life by mastering the art of daily living. When disease and suffering came to human beings, the great sage Bharadwaj assembled to the Himalayan mountains and journeyed to the heavens to learn the science of Ayurveda from the Indra. From there, he gathered more sages and taught the teachings, passing them down in sutras, mantras, or songs, bringing hidden knowledge to consciousness. They created sacred treaties or Vedas, such as the Chakra Samhita, Rig Veda, Yajurveda, Arthaveda, and Samaveda. Here we see a general overview of how Ayurveda was passed down. Ayurveda is said to be created by God, creator of universe, Lord Brahma. He then passed it down to Dakshi Prajapati, who is connected to Lord Brahma. He then taught the Ashwini Kumara, who are twin doctors, divine doctors of the universe. They then taught it to the Indra, who taught it to 3 sages. The sages created the Chakra Samhita, Rigveda, Yajurveda, Samaveda, and Arthaveda, which are ancient scriptures that teach Ayurveda. Lord Brahma, God creator of universe and Ayurveda, passed down the knowledge of natural law to ease suffering and disease. Ayurveda is said to be a gift from God. The Daksha Prajapati are connected to Lord Brahma as his thumb, the first celestial figure to maintain the universe. Ayurveda was conceived from Lord Brahma and given to Prajapati to help the universe. The Ashwini Kumara are twin doctors. They're divine doctors of the universe, healers and gods of Ayurvedic medicine. The Ashwini Kumara learned Ayurveda from Daksha Prajapati, their grandfather. The Indra rule the heavens and are teachers of medical knowledge to the sages. The Indra received the knowledge of Ayurveda, or the study of the Chakra Samhita and Sushruta Samhita, from the divine twin doctors of the universe. It included an ancient Indian science of medicine and nature. The text gives medical and social aspects, various topics such as disease, healthcare, physician educational training and specialization, as well as how to interact with society. Bharadwaj is one of the 3 great sages that learned Ayurveda from the Indra and brought it to earth. He is part of the ancient scriptures that teach Ayurveda, the Chakra Samhita, as well as the 4 main Vedas, Rigveda, Yajurveda, Samaveda, and Arthaveda. With this knowledge, 8 branches of Ayurveda became to be. There is internal medicine, pediatrics, psychiatry, ear, nose, throat, and dentistry, surgery, toxicology, gerontology, and sexual health. There are many definitions of health, but the definition of health according to Ayurveda is one who is established in self, who has balanced doshas, primary life force, balanced Agni, fire of digestion, properly formed dhatus, which are tissues, proper elimination of malas, which are waste products, well-functioning bodily processes, and whose mind, soul, and senses are full of bliss. This is called a healthy person. With the rise in Western medicine, society and people have turned away from herbal practices and daily lifestyle changes. Though people continue to suffer, there's been a rise in Ayurvedic professionals to help guide people to correct their imbalances that cannot be seen through diagnostic tests. Yoga and Ayurveda came to the US in the 1970s, and from there, governing bodies such as the National Ayurvedic Medical Association and the Ayurvedic Accredited Commission have helped and boost Ayurvedic professionals in their training and diagnostics to help people. They recognize Ayurvedic health counselors, Ayurvedic practitioners, and doctors of Ayurveda. An Ayurvedic health counselor is competent in health promotion and disease prevention. They use the principles of Ayurvedic medicine to create diet, lifestyle recommendations according to the patient's assessment of body constitution, imbalances, and state of mind. They educate, motivate, support, and counsel patients in implementing Ayurvedic principles. They will refer patients whose disease states is beyond stage 3 to appropriate healthcare professionals, Ayurvedic and Western. An Ayurvedic health practitioner is competent in managing and treating disease from an Ayurvedic perspective. Using Ayurvedic etiology, pathology, diagnosis, and management of disease prevention, and health promotion, they advise diet, lifestyle, and can advise women on pre-postnatal, as well as newborns and children. They can prescribe herbs, purification and rejuvenation therapies. They understand Western anatomy, physiology, and pathology. They recommend preventative care and treatments for common conditions of the head, neck, and mild pathologies of the mind. Serious cases are referred to a doctor of Ayurveda or Western medicine. Doctors of Ayurveda are similar to Ayurvedic practitioners. An Ayurvedic doctor has extensive knowledge and clinical experience in all 8 branches of Ayurveda. They have additional experience in teaching, demonstration, panchakarma training, and research methods. They understand disease from an Ayurvedic and Western perspective, including medical diagnostics, treatment, terminology, pathology, pharmacology, diagnostic reports, and practices. They do this to interface with Western medical communities, not to order tests or prescribe Western medicine. They order Ayurvedic therapies and contribute to research and case studies within the medical community. Other recognized Ayurvedic professionals are Ayurvedic yoga or diet therapists, also Ayurvedic massage and bodywork therapists. The deeper aspects of Ayurveda, Sankhya, and yoga philosophy will be discussed in Lesson 2. We have covered where and why Ayurveda was created and its origins, the scope of practice for Ayurvedic professionals, and their accrediting boards. Please follow up with a meditation and worksheet to help deepen your self-care needs.